Today we are discussing about the age factors in orthodontics. There are many age factors that result in a good or bad result of the orthodontic treatment. So we should know about the different types of age factors in orthodontics. Also, in introduction, there's many factors affecting the treatment mechanism and prognosis. One of the important factors is age factor. So during diagnosis and treatment on itself, we should know about what are the age factor that affect the coming treatments. So then only we can create a better treatment plan to correct the malocclusion for a particular at that age. Here today we will discussing about the age factors under the age factors in orthodontics. These are the topics: the diagnosis and age, treatment and age, and tooth movement and the age, young and adult patient versus adult patient. The first one is the diagnosis in orthodontics. The diagnosis forms a vital part of successful orthodontic therapy. So, diagnosis of an abnormality in a dentofacial complex should be considered during the treatment plan. But for that, we should know about what is the normalcy of the growth, because some malocclusions occur during the growth time. It is normal. That types of malocclusions are called transient malocclusion or self-correcting anomalies. So we should know about the normal type growth of the dentition. Otherwise, we misjudge that was a malocclusion and treat it. So it is very important what type of self-correcting malocclusions are occurred with a particular age or particular period. The normalcy is different from age to age. This normalcy we already told. This normalcy malocclusion is called self-correcting anomalies or transient malocclusion. Some examples are open bite celiac gum part, spacing in deciduous dentition, first deep bite, the flesh terminal plane, ugly duckling stage, second deep bite. So these type of malocclusion need no treatment because it is self-corrected during the growth or during the development of dentition. So we should know about what are the normalcy. Then only we can diagnose the abnormality, the original abnormality or original malocclusion. Yes, the age and growth status. The chronological age will sometimes mislead us during the treatment plan. So we should not consider the chronological age always during the treatment planning, because there are some more other ages like skeletal age or bone age, dental age, physiological age, etc. etc. Dental age means the classification of teeth. We can find the dental age by using OPG, by using the emergence method. The skeletal age we can assess using hand-test radiographs, cervical vertebral radiographs. So these may be different from the chronological age sometimes. Because, for an example, if a child with a fat child, the fat child shows more dental and skeletal age compared to the chronological age. Means the dental age and skeletal age is beyond the chronological age in this type of children. But if in the lean fellow or a lean child shows less dental age or skeletal age compared to chronological age. So, if we give some type of orthopedic appliance in 10 years or 9 years to a child, if its chronological age is 9, but the girl is a fat, so its maturation, the skeletal maturation is already occurred. So there is no use of orthopedic use for that child. We get no result because already the skeletal maturation is good there. So we don't always use the chronological age for the treatment plan. This may mislead you to a wrong treatment plan. Next, the boys' growth status and girls' growth status. The girls shows always a ahead of growth maturation compared to boys. So it means the girls mature early compared to boys. So some type of orthopedic or myofunctional appliance treatment should be doing girls early compared to boys. Third one, the fat individual, lean individual. I already told the example because fat individual shows early maturation. So we should take care of that child for a treatment as early as possible compared to a lean individual. The orthodontic and orthopedic applies most effective during birth. So the assessment of skeletal maturation is more important than the chronological age. That is the age and growth status. Treatment and age. Early treatments and late treatment. Some treatment should be done the early ages and some treatment should be done the late ages. That is the treatment and age, relation to treatment and age. The early treatments, the concept is to catch them young because we can use the growth for the treatment. The benefit are the scope for growth modification, scope for prevention and interception, harness natural growth force, and minimize the psychological distress. That is the importance of early treatment. We can use the growth or also the minimize the psychological distress for the child around him, or harness the natural growth force for correcting the malocclusion. Sometimes we can prevent or intercept the malocclusion during this age. The late age treatments are the limit, but have a limited treatment options. Sometimes we should compromise on treatment objectives. Mostly the orthodontic surgeries are the late treatments. If it is a skeletal case, orthodontic surgery should be done because we can't use the growth of the individual because growth is already over. The disadvantage of this late treatment are there's no scope for the growth modification, no scope for the prevention and interception. We can't harness the natural growth force. These are the feature of late treatment. Next, the tooth movement and age. There's an relation with tooth movement and age because the younger individual shows more tooth movement compared to the adult because the vitality of tissue, more vascularity in a age compared to the adult. So there is a rapid tooth movement compared to the adult. Next, role of growth is most effective during growth period. We can do tooth movement more during growth period compared to the growth hormone. Next, the role of apical foramen. The younger shows the open effects of the root and so lesser chance of pulpal damage. But in adults, during the orthodontic treatment, there's a chance of pulpal damage is more because the apex is closed. Fourth one, the density of bone. The younger shows the less density of bone, so the tooth can easily move through the bone and faster the tooth movement. But in adult, the density of bone is high, so the tooth movement is lower compared to the younger adult. Group to be worked with. Young more favorable, adult less favorable. Diagnosis: the young individual needs routine type of diagnosis, but in adult we should consider the periodontal issue, impaction, loss of teeth, etc. Applying selection: young functional applying and orthopedic is better for the growth correction and tooth movements, and the adult the fixed appliance therapy and surgery. The periodontal problem is minimum in young and more chance of periodontal problem in adult. For patient motivation, less motivation and cooperation is we got from the young because they all are taken by their parents. But in adult, they are more motivated and cooperated. So these are the age factors of in orthodontics. It's very important topic because we should know about the different age and different aspect of the patient. Otherwise, we prepare a wrong treatment plan and execute it. So we take longer time, we get a poor result, etc. So we should know about the different age and different anomalies on the during their that period. So we can avoid this problem.